Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, we're doing another Kahoot and we're going to be covering community health nursing. Now, before we get started, as always, I'm going to ask you to please support me and support this channel. How can you do that? I'm so glad you asked. First thing you can do is like this video. You're gonna love it. Please go ahead and give me a thumbs up now so you don't forget. Subscribe to my YouTube channel if you haven't done so already. And be sure to check out my website, nexusnursinginstitute.com. I have so many wonderful resources there available for you. You can check out my audio lessons, my new book, my very first book that I wrote for RN students. It's NCLEX RN NGN cheat sheets. This is for the RN student, and this is not only for the students who are studying for their boards for RN, this is also helpful for the student that is studying for their exit exam because guess what? Your exit follows the same pattern, the same trends as NCLEX. The whole purpose is to see, are you prepared to go take that big test, right? And so this book that I put together, this is not even I don't want to say this is not my book. What I mean to say this book is a compilation of just concepts that have been reported back to me from my students who I've tutored. They've gone, they've taken boards, they've passed, and they've came back and reported to me, Professor D, I saw this, I saw that, I saw this, I saw that. And certain concepts that keep showing up over and over and over, regardless of the state that the student is testing in, that's what I included in this book. I do have a book that is coming out for the RN student and for the PN student that is not feedback given from other students, but it's going to be a book that I write and it's going to be for students who are currently in the nursing program. However, I do want to help the students who are preparing for graduation or have already graduated and they're studying for their board. So this is the first one out. The next one out is going to be for the PN VN student. That one's coming out in about 5 weeks. So guys, I'm seeing your emails. I'm seeing them. It's coming. I'm only one person, so just give me a little bit of time. That's coming out soon. And then afterwards will be the one for the nurse practitioner students. After that, I'm going to roll out my test bank. I know you guys have all been waiting for that test bank. Then after that, I'm going to go ahead and roll out some resources for students who are currently struggling in the program right now. Um, Almost daily, you can find me covering a variety of numerous nursing topics across my social media platforms such as TikTok, Instagram, Facebook, YouTube. My handle is the same everywhere. It's called Nexus Nursing. So check me out on all the major platforms. Again, Nexus Nursing. Be sure to check out my book on my website, nexusnursinginstitute.com. All right, guys, without any further ado, let's get started. Community health nursing. First question. Okay, you're planning a health fair for a local senior center. Which topic should be highest priority? Here are your options. Exercise classes, fall prevention strategies, nutritional supplements, or stress management. Again, you're planning a health fair for a local senior center. What topic takes the highest priority? Is it going to be exercise classes? Let me turn the camera for you, guys. There we go. Exercise classes, fall prevention strategies, nutritional supplements, or stress management. Very good. Fall prevention strategies. Why? Well, think about what community health nursing is. You are identifying and you're addressing the biggest risks in that community. So, for this question, who is our community? The local senior center, the geriatric population. So, what do you think is going to be the biggest risk in that population? Safety issues such as falls. Remember, the older that you get, it's just wear and tear of the body. The muscles aren't as strong as they used to be. The bones aren't as strong as they used to be, right? You want to have fall prevention strategies. The older that you get, the more drugs, medications you're going to be on. Got polypharmacy, that can cause fall risk as well, right? Exercising classes, that's great. Helps you get stronger. Wonderful. Nutritional supplements, you're not going to tell them to take it because you got to stay within your scope of practice, but nothing wrong with teaching them about different nutritional supplements, teaching them stress management. That's great. But again, when it comes to community health nursing, you have to look at the community that you're being questioned about and identify the biggest risk because the biggest risk, that's what you're going to be addressing. Okay. All right. Next question. Okay, so you're visiting a homebound client with tuberculosis. Which action would be most important? Is it to encourage a high protein diet? Is it to teach a family to wear masks when they're entering the room? Is it to advise a client to take their medications until the symptoms improve? Or is it to recommend that the client spends more time outdoors? What would be your priority as a community health nurse? You're visiting a patient that's homebound, they've got TB. What's going to be your priority action? Very good. You're going to teach every single one of those family members that they have to wear a mask when they're entering the room. Let's talk about TB. Guys, this is an airborne infection. Airborne. This means that those particulates are very, very small. And when I say small, I mean less than 5 microns. You need to know that for NCLEX. Please write that down if you did not know. Okay. Less than 5 microns, those particulates stay suspended in the air for hours. And that's why tuberculosis is considered a public health safety issue because that person that has TB, they cough or sneeze in a subway or a train or a bus, public bus, wherever, they walk away, those particulates stay suspended in the air for hours. So anyone that passes by and breathes it in, guess what? They can be infected. You need to know that it's airborne precautions. You want to make sure that you teach the people who are going in the room to wear masks. Why? We want to decrease the risk of transmission. That's right, less than 5 microns. Okay, you're conducting windshield surveys of neighborhoods. What is the main purpose of this activity? Would it be to interview key informants? Would it be to evaluate hospital discharge planning? Would it be to identify, you guys know I can't pronounce. You see that E word? I'm not going to try to pronounce that. Trends. Or would it be to collect data on community resources and conditions? This word that I can't pronounce, it's just a fancy word for diseases. So different diseases that are prevalent in certain areas. That's all it means, okay? I know what it means. I just can't pronounce it. Very good. To collect data on community resources and conditions. So basically, what you're doing, guys, you're driving or you're walking around the neighborhood and you're noting like deficiencies or risks when it comes to, resources, safety, health. That's right, collecting. Okay. And so I guess it's called windshield survey because you're driving around looking through your windshield. I don't know why they call it windshield survey, but that's what you that's what you need to know, okay? You're basically getting baseline data of that particular area. Okay? All right. Okay, you're teaching a group of mothers about SIDS, sudden infant death syndrome. So you're teaching a group of new mothers about SIDS prevention. Which statement indicates understanding? I will place my baby on the stomach to sleep. I will put stuffed animals in the crib for comfort for my baby. I'll place my baby on the back to sleep. I will use soft bedding to keep my baby warm. Very good. I will place my baby on the back to sleep. Now, while the baby is awake, there's no problem putting the baby on the tummy. You want them to have tummy time. You don't want them to have a flat head, right? So, yes, you can give them tummy time while they are awake. But when they're asleep, you have to put them on their back. So just remember that phrase, back to sleep. Okay, different ways of preventing. What did I do now? Your life's not eligible for recommendation and restricted in search results because it's primary. You see, this is exactly what I was telling you guys. It directs people off the platform. I did not even tell you guys where you could go get my book. I did not say anything about that. Okay, moving on. Guys, please, during this live, let's just do the Kahoot. You can worry about all that other stuff later. Okay, please. I'm getting violations for no reason. So what are you going to teach about SIDS? You're going to teach the parents, of course, back to sleep. Some other important things you're going to teach. No soft bedding, no soft mattress, no soft pillows, no soft toys. All of these things are things that can suffocate the infant. Right? You're going to make sure that the mattress is firm. You're going to make sure that there's no space between the mattress and the actual crib itself where the baby's head can get stuck in between and they suffocate. You are not going to co-sleep with the baby. The baby has to have their own crib. You're not going to let the baby sleep in the bed with you. Okay? That's right. No extra blankets. The code to get in is 382-2108. 382-2108. Okay, you want to put it back a little bit? Is this better? Is this better for you, or you want it closer? Okay, hold on. All right. Next question. Okay, you're working in disaster response triaging victims of a mass casualty event. Which client should be seen first? I feel like I didn't say that right. Okay, so you're working in disaster response triaging victims of a mass casualty event. Which client should be seen first? Here are your options. A client with an open femur fracture and stable vital signs, a client with third degree burns covering 60% of the body, a client with minor abrasions to both arms, a client with a sucking chest wound and dyspnea. Who are you going to attend to first? You guys are doing great on the live. Very good. Very good. The client with a sucking chest wound and dyspnea. That's who you're going to see first. Okay? You're going to see that patient that has an immediate life-threatening injury that that or condition. That's what you're going to have to address. Now I have a question. I have a question. Why did you not go with the client with third degree burns covering 60% of the body? Because I want to talk to you guys about that for a second. On the live, can some of you guys explain? Yes, I'm going to explain it to you. I just want, thank you. Who said that? Hold on, hold on, hold on. Oh, these comments are going so fast. Okay. Whoever that was that said that, thank you. They are not likely to survive. Thank you, whoever that was on the live. They're not likely to survive. When you're doing triage in the hospital, whoever is worse off, whoever is most likely to, that's who you're going to get seen first, right? But when it's a mass casualty, mm-mm, you switch it. Whoever is most likely not to survive, and I feel so bad saying this, but this is just what it is, guys. You write them off. Okay? That's what it is. You classify them as what? It starts with an E, expectant. They're expected to. When it comes to mass casualties, you want to save as many people as possible. So the ones that you expect to let them go, keep it moving, right? That's number one. Number two, our patient with the sucking chest wound and dyspnea, ABC, airway, breathing, circulation, you're going to go to them first. But they have a chance of survival. That's why you're going to them also. Okay. And I want you to remember this, guys. When you're doing community health nursing, you got to kind of put on a different hat. Don't think that about you triaging in the hospital. Think about you triaging out there in the field where there's that mass casual event, that casualty. If they're expectant, which means they're likely to, so sorry, we're not wasting our, oh, I hate to say waste. You know what I mean? We're not going to divert our time and effort towards the person who's expected not to make it. We need all that time and effort towards the ones who has a chance of making it if we get to them right away. Does that make sense, guys? So I don't I don't want to seem insensitive, but I do want you to pass your test. Okay? All right. So anyway, you're going to go to the patient with the sucking chest wound and dyspnea. You're going to go to them first. Who would you go to secondly after that patient with the chest wound and dyspnea on the live? Who would you go to secondly? I'm seeing red, I'm seeing blue. I just told you that blue is expectant. You're bypassing them, so it can't be blue, it's going to be red. After that patient with the sucking chest wound and dyspnea, you're going to go to that patient with an open fracture. Open fracture, you know what that means, guys? So a closed fracture, the bone's broken, but at least the skin's intact. An open fracture, not only is the bone broken, it is protruding through the skin, which puts you at high risk for what? Infection, sepsis, hemorrhage, shock, right? They're not as bad as green. That's why we're going to green first. But immediately after that, we're going to go to them. At least their vital signs are stable. They've got a chance. And then last, we're going to go to that patient with minor abrasions to both arms. Their life isn't at risk. They'll be all right. Okay? All right, let's keep it moving. Okay, you notice an increase in asthma related absences among students. So you're a school nurse. What's your best action? You notice an increase in asthma related absences among students. What would be your best initial action? Would it be to recommend all students be screened for asthma? Would it be to notify parents that their child needs to see a provider? Would it be to investigate environmental triggers in the school? Or would it be to request more inhalers to be stocked in the nurse's office? What do you guys think? Very good. Investigate environmental triggers in the school. Again, when it comes to community health nursing, the first thing you always want to do is assess and address risk factors in your community, in your area. For this particular question, if you're the school nurse, you're going to be assessing and addressing those factors in the school, right? You're going to be looking for environmental risk factors. You're going to be looking for pollen. You're going to be looking for mold. You're going to be looking for dander. You're going to be looking for chemicals or smoke or anything that can trigger an asthma attack or reaction, right? That's right, Mass. Figure out what's happening in the school because that school is your what? Community. Okay, you're working with migrant farm workers. Which issue is most important to assess? Would it be vitamin D deficiency? Would it be heat exhaustion? Would it be obesity or would it be diabetes? Again, you're working with migrant farm workers. Which health issue is going to be most important for you to address, for you to assess? What's it going to be? Very good. Heat exhaustion. Seven people chose vitamin D deficiency, but how are you going to have vitamin D deficiency if you're a migrant farm worker? You're out in the sun all day. You're getting vitamin D from the sun rays, right? So not so much vitamin D deficiency. You're a migrant farm worker. That is hard work. You are moving about a lot. When's the last time you saw obese migrant farm worker? I've never seen one. So, no, I don't think that would be a priority and not diabetes. It's going to be heat exhaustion. It's going to be, you got to think about your community that you're working with and what they're going to be at risk for. They're out in the sun working hard. You're going to be concerned about heat exhaustion. You're going to be concerned about occupational exposures such as, pesticides, right? Them being exposed to chemicals that they use to make the plants grow or whatever. Those kind of things that they would be exposed to, right? Thank you. Dehydration. You're going to be concerned about dehydration. So you're going to be teaching them to make sure that they stay hydrated in the sun. Very good. That was a good one. Thank you. Okay, a nurse provides education on influenza vaccination at a local clinic. This represents which level of prevention, primary, secondary, tertiary, or preventative. Let me tell you guys this right now. If you are taking community health nursing, they are going to kill you with these types of questions. If you don't know anything else, baby, make sure you know the difference between well, I can't say that because I'll give you the answer, but make sure you know the difference between all the different types of preventative measures because they're going to kill you with those. You got to know them. You guys are doing great on the live. Very good. Primary. 31 of you guys chose preventative as a preventative level of prevention. Guys, I made that up. There is no preventative level. There's primary, there's secondary, there's tertiary. Okay. So let me explain the difference because you guys, I promise you, you're going to see this. So when you think of primary, I want you to think the patient doesn't have it and we don't want them to get it. So we're going to do primary preventative. So that would be things such as vaccinations. The patient doesn't have the flu. We don't want them to get the flu. That's why we're giving them the vaccine. Another example would be something like education, right? The patient doesn't have diabetes, so we're going to teach them how to avoid getting diabetes so they don't get it. That is primary. Secondary. Secondary, you might have it. We don't know if you have it yet, but we'll test to see if you have it and test to see how bad it is. Example of that would be something like breast biopsy, mammography, colonoscopy. We don't know if you have it, but we're testing to see if you do, and we want to see how bad it is. Okay. So that is secondary prevention. Tertiary prevention, you already got it. We just want to prevent it from getting worse. So that would be something like rehab. So you already got the stroke. We just want the complications to be minimal. So you'll get physical therapy or speech therapy, right? So that's the difference between primary versus secondary versus tertiary. Make sure you guys, yes. Emily said secondary, that S in secondary stands for screening. Yes, absolutely. Perfect. Okay. Make sure you guys know the difference between first, second, and third. Okay, a client with uncontrolled hypertension is enrolled in a home health program. Which prevention is tertiary? And you all better get this right. I just explained to you the difference. Okay, here are your options: teaching stress reduction exercises, conducting routine blood pressure screenings, administering prescribed antihypertensive medications, or organizing a hypertension awareness campaign. So your patient has uncontrolled hypertension and they're enrolled in a home health program. Which prevention is considered tertiary? Okay, administering prescribed antihypertensive medications. Why? Remember, in tertiary, they already have it. We just want to keep it from getting worse. This patient already has a hypertension. We just want to keep it from getting worse, right? So we're going to give them their antihypertensive medication so they don't what? Have a stroke. Now, 13 of you guys went with teaching stress reduction exercises. Teaching a patient that the patient has they already have hypertension, teaching them stress reduction exercises, that would be a form, because remember, teaching is what? Education. So that would be a form of primary prevention, because I don't know if they got stress. Is there anything in here that says the patient already has stress? No. Let me tell you, if it's education or it's vaccines, I'm telling you right now, off rip, you don't even have to think about it. It's going to be primary, okay? Education or vaccine, primary. Okay, next question. You're developing a program to prevent childhood obesity. Which intervention is most appropriate? Would it to be to distribute weight loss supplements to overweight children? Encourage parents to engage children in daily physical activity, refer the children with obesity to surgical programs, or advise the children to avoid breakfast to cut calories. You, the nurse, you're developing a program to prevent childhood obesity. What intervention is most appropriate? By the way, that program that you're developing to prevent childhood obesity, would that be primary? Would that be secondary? Or would that be tertiary? Okay, very good, guys. Yes, that's primary because we're trying to prevent it from happening. It's primary. And so, what you're going to do, you're going to encourage the parents to engage children in daily physical activity. Their children, guess what children love to do? Play. You're going to talk to the parents, take them to the park, take them for a walk around the neighborhood. Kids have lots of energy. Take them for physical activity. One thing about children, don't ever use that word diet, guys. If you're taking peds or you're taking a course like this, when it comes to children, you're going to use the phrase healthy. We want you to eat healthy foods. We want your body to be healthy. We don't ever use the word diet, okay? That's a big no-no. Okay, you're assessing a family living in poverty. Which intervention best addresses the family's immediate needs? Would it be provide referrals for employment services? Would it be encourage participation in parenting classes? Would it be an assist with enrollment in Medicaid or CHIP, or would it be teach about healthy meal preparation? Again, you're assessing a family that is living in poverty. They are living below um the what's that word, the phrase I'm looking for? They're living below the poverty line, okay? What is the most important thing to address? Okay. I saw a lot of yellows and a lot of green on the live. So yellow's the correct answer. You're going to assist with enrollment, Medicaid, or CHIP. We'll talk about that in a second, but I want to look at the wrong answer that a lot of you guys on the live went with. What is green? Teach about. Okay. Let's follow your line of thinking, guys. I told you that you are assessing a family that's in poverty. They're poor. Which intervention best addresses their immediate needs? And your bright idea is to teach them about healthy meal preparation. Listen, that's rich people talk. That's talk for people who got money. Do you know? Let me tell you something. And listen, I promise you, you go to Whole Foods and you go to Publix, there's a big difference. Okay? Healthy meals are expensive. Foods that don't have any chemicals, that don't have colors, that don't have dyes, that don't have GMOs, that are not genetically modified, it is expensive. Trust me. It's very expensive. So how this family that's living in poverty, how is that addressing their immediate needs? Their immediate needs right now is to live, to get food, and to be healthy. It's going to be Medicaid. Medicaid's health care for people who are financially, what's the word I'm looking for? Underprivileged, right? And chips so they can get have access to food. The priority is keeping them alive. Someone said Publix expensive, we go to Aldi. Well, listen, Publix is expensive as Whole Foods. I'm at Whole Foods freaking 12 times a week. I hate it. Aldi. I tried Aldi one time, and you know what? Aldi reminded me when I'm in Europe, because you see how here in the US when you go shopping, like they give you your bags. They put your groceries in your bags. Not so much. When you're in Europe, first of all, you bring your bags, or they have like paper bags that you have to purchase. I just Aldi reminds me of like the Netherlands. It reminds me like of Amsterdam. It's not for me. Okay, I'm getting off topic. Anyway, the point is, you guys need to, when it comes to a patient's immediate needs, go back to Maslow's hierarchy of needs. What physically keeps them alive? Their life, being able to eat. It's going to be the Medicaid and chip. After we've addressed that, then we could talk about healthy meal preparation. Does that make sense? All right. Okay, a nurse working after a tornado is assisting client with PTSD symptoms. This represents which level of prevention? So you're a nurse and you're working after a tornado and you're helping patients that have PTSD. What level of prevention is this? Is it primary, secondary, tertiary, or this is not a level of prevention? Hmm. Very good. It's tertiary. Remember, primary is education, vaccines. They don't have it. You want to prevent them from having it. Secondary is screening. We want to see how bad it is. Tertiary, you already have it. We just want to keep it from getting worse. They already have PTSD. It says right here, clients with PTSD symptoms. They already have it. You're just trying to prevent it from getting worse. It's tertiary. Okay, last slide. You're a school nurse and identify several children with head lice. What is the best action? Is it to exclude all affected children until they're knit free? Is it to notify parents and provide education about treatment? Is it to report the outbreak to the CDC? Or is it to apply medicated shampoo to each child in the school? I'm sorry, this is the last one, but if you want to come in, the code is 382-2108. 382-2108. This is the last slide. And guys, my son has a game I got to get to, so I'm not going to stay on the live with you afterwards. I'm not going to stay long at all. I'm just warning you. Very good. You're going to notify the parents and provide education about treatment. For the seven of you that chose exclude all affected children until knit free, the fact that you saw that word right here, all, what did I teach you about that word? Don't ever choose that as an answer unless they're asking you for the wrong answer, right? Wrong. Report the outbreak to CDC. No, there are certain things that do need to be reported to CDCs, like certain um sexual transmitted diseases like, chlamydia, gonorrhea, HIV, things like that do have to be reported to the CDC. Head lice is not one of them. And apply medicated shampoo to each child. That's another way of saying to all the children in school. Absolutely not. That's number one. And number two, everyone is not. infected, why would you do that? Even a child that is infected, they need to go home. That's their parents' responsibility, not yours. Okay. So you're going to notify the parents and teach them what they need to do, which is to use that medicated shampoo that they're going to get from the healthcare provider. All right, guys, let's see how you guys did.